Welcome back to another episode of Time Out with the Sports Doctor podcast, where life, sports, and medicine intersects. We are glad that you are part of this growing community where we strive to help you strengthen your mindset, help you grow your assets, and help you achieve whatever level of success that you want for your life. Go to our website at Dr.Derrick, thesportsdoctor.com, where you can find all the latest content, and you can also follow us on our social media channels. Now, let's get into this episode.
Hello and welcome, everybody. We're thrilled to have Dr. Derrick Burgess joining us today. Dr. Burgess is an assistant professor of orthopedic surgery at the University of Mississippi Medical Center and also serves as the head team physician for Jackson State University Athletics. He's taken some precious time today to share with us about his experience and financial wellness and as a young doctor into his attending career. Dr. Burgess, thank you for joining us today. Just really grateful for you to be here.
Hey, thank you for having me. I can't wait to have this discussion with you and look forward to sharing with others.
Awesome. Just to kick things off, I know a lot of people know you've been out with podcasts and you put a lot of content out there, but just for those that don't know you, take a minute just to share a little bit about where you came from and your journey and where you're at now.
Yeah, so I'm Derrick Burgess. As you mentioned, I'm a board certified orthopedic surgeon, and my specialty is sports medicine, meaning that I do a lot of arthroscopy and minimally invasive procedures. I do work with athletes, but not exclusively. I also take care of from kids to adults. So a lot of weekend warriors, a lot of your kids, just regular injuries. But I really enjoy taking care of athletes. I'm in my 13th year of practice, which is crazy to believe. Now a mid-career surgeon, which is hard to believe because many days it feels like I'm really just getting started. But I've really enjoyed this run. I've really enjoyed just learning and continuing to grow. And that's really what medicine is about.
Yeah.
And from a financial standpoint, when you finish in that first phase of your career, you're just so focused on learning medicine and learning procedures that many times you can ignore your finances and your financial stability and future. I'd say COVID for me was really a time when I was able to slow down and also see that medicine might not be as secure as I thought it was.
Mm-hmm.
So at that point, it was really a mindset shift. And I started to educate myself more on financial topics, which has kind of led me to podcasting and doing some of the other things that I do.
Yeah, no, that's really good. One point I want to mention and highlight that you just said, which I think is just the reality of the situation, is that doctors, when they're in training, they're focused on learning the clinical side of medicine, right? They're learning how to do all the things to be a great doctor. And a lot of that doesn't include the life part of living and being a physician. So some of the practical pieces and topics get left out. And a huge one of those is the financial side of things. You spoke to that. So, obviously you went through plenty of years of training. Was there a certain point in time in training where you started thinking about finances at all? Or was it just kind of a complete afterthought until after you got done with training?
Well, I think you always think about it. It's always in your mind. But for many people, you have almost no control over what's going on to be able to get to that end of the road, right? Because I tell the story of sitting in the medical school classroom, and you always have the financial advisor come down each year and kind of give you a lecture about your loans. But for most people, you have to just accept it. And it's no matter what's in the small print, you check the box, you get your loans, you keep moving. Then you transition from medical school to residency. I mean, you start to get a paycheck and you do the math and you're like, okay, I'm not making a whole lot of money. The check is decent, but for the hours I'm putting into it. So you always are aware of finances. And especially I trained in Washington, D.C. So I'm living in an environment where it's very expensive and I had to budget. I didn't ignore my finances at all because I had to budget almost every dollar of my money just to live in Washington, D.C. So I wasn't able to, or I wish I had, but I didn't pay down any of my debt during that time. And then about midway through residency, I hear about disability insurance. And it was just one of those things. I believe it was somebody from your company that came out, gave a lecture, and I knew nothing about it, but I learned the terms own occupation are important. And everybody else was doing it. So I was like, okay, I'm going into orthopedic surgery. I have to be able to protect myself. I don't really understand what I'm doing, but I know I need this. So I got the disability insurance at that point, which was one of the major steps. But at that point, I was really more reactive than actually proactive in learning and trying to do what's best for my financial future.
Yeah, I think that's a pretty typical story in the sense of being reactive versus proactive. I mean, you got a lot on your plate, especially in
Yeah,
those earlier years. You're trying to just navigate what does it look like to get through all these hours of working and
day
then
by
come
day.
home. And yeah, when it comes to trying to make decisions, you have decision fatigue. You've been making decisions all day long and they're critical ones. And the last thing you want to do in your quote unquote free time is think about financial things and what are the next things I need to check off the list. So that's some really insightful testimony there. You mentioned this a little bit and touched on it, but what would you say were the biggest challenges from a financial standpoint when you were in those early career stages, leaving residency, transitioning to an attending role? How were you managing the essentials like rent and your daily expenses? What did that look like for you?
I did a year of fellowship, so I had an extra year of training at that resident level for the most part from a financial standpoint. I'll talk about two things, one personal and one kind of a mindset. So
Sure.
you've trained for so long, medical school, residency, and now you've made it, right? Now you're a doctor. Now you have that first job. You're a surgeon. Your paycheck might have increased 8 to 10 times what you were making before. And for many people, this is the first time you've seen this type of money. So at the beginning, I didn't think you could spend several $100,000. And you've been deprived to some extent for so long that the car, the house, the shoes, the clothes, the trips, they're all very enticing. And it is very easy to get sucked into that. And it's very easy to blow through all your money without thinking about retirement, thinking about investments. And then at the same time, you have to start back paying that student loan. So that's one thing. And then on a personal note, for me, early in my career, many times when we finish, we think we made it, right? So we think about getting that dream job and living happily ever after. However, for many people, that dream job can become a nightmare. And for me, my first job did just that. I worked for less than a year and I was in transition again. So
Hmm.
at that point, I really saw how vulnerable you can be as a physician. And I was able to make some changes in my approach to my debt and my relationship with money overall. I guess it kind of accelerated me to wanting to get financial freedom and wanting to be able to pay down my debt and be debt free and things of that nature.
Yeah, so one of the very basic financial wellness activities that anybody should do is budgeting,
Right.
trying to figure out where their money is going so you can tell it where to go.
Mhm.
So, what did that look like for you in residency? Did that exist for you? It doesn't for a lot of physicians. So, I'm curious if that's part of your story or not, the budgeting side.
It did. And I think I started budgeting very early. My parents gave me a checking account, and I'm old enough that I walked around with that checkbook in my
Nice.
back pocket. So every time I would write a check, I would have to put it in the ledger. So I
Yeah,
think just from doing that, I was starting to budget even early
good.
on. And as I mentioned during my medical school career, I had roommates. That's the only way that I could survive in that environment off my loans. But at the same time, I knew what okay, I need to pay this for utilities. This is my share of utilities, my share of gas, my share of water. How much do I eat each month? Which is really surprising to many
Yeah.
people. If you really write down how much money you spend on food, you will be really surprised. So it took that for me to be able to live in Metro DC. And I was always frugal. My friends always said I was cheap. I chose the word frugal. However, it came in handy and it's
Yeah.
been able to help me do things that many others can't do.
Yeah. That's awesome. I think one of the big things, and you've mentioned this as well, is doctors, they get especially that first attending paycheck and it's a big number,
Yeah.
right? And there's a lot of things they aren't considering when that first paycheck comes through with regard to taxes. A good chunk of that paychecks, it's not going to be existent. And then you have all the other things that are kicking in. You got student loan repayments, you got car payments that may have now come into the picture because you wanted to reward yourself for making it through that slog, and now maybe there's a house on the docket too. So very quickly, as you alluded to, your paycheck can erode. And so budgeting is kind of annoying it is to execute on it and dull it is one of the most powerful things a young doctor can do in order to make sure they're on the right track because it's really easy to get off track early on.
Yeah, I can't agree more. You have to give every dollar a name, as
Yeah.
Dave Ramsey would say, because if you don't tell your money what to do, it will do it until you deal with the consequences later.
Yeah, you either master your money or it masters you. That's how that
Absolutely.
works. So you maybe are a little bit ahead of the curve than maybe your traditional doctor that came through training and residency, you were budgeting, you kind of had some money consciousness going on.
Correct.
And then whether you knew it or not, you decided to purchase disability insurance in that stage of the game, which I think is incredibly prudent. But like most doctors, maybe you didn't recognize the real need for it, or maybe you felt like you still had that invincible thing, but it's maybe one of those things your physicians were telling you, hey, you got to do this. It's just one of the things you got to
Right.
do as a doctor. What would you say to some of those residents and young early career physicians who kind of have that invincibility mindset and they don't think anything's ever going to happen to them?
Yeah, unfortunately, that's not true.
Yeah.
And we never know when our day is coming. You don't know when you could wake up and without losing some of your function or something traumatic could happen.
Yeah.
And we really do not have a crystal ball that we know our future. Yes, you have a lot of bills. Yes, you don't have a lot of money, but there are certain things that can be put off and there are certain things that are more of a necessity. And I feel that disability insurance is not something that you can wait on because you're never going to be as young as you are today, and you're not going to be as healthy as you are, because even if you get healthier, once you've had a diagnosis from an insurance standpoint, life insurance, disability insurance, that diagnosis is there, whether it's treated or not. So you never get any younger or healthier. And that's why buying disability insurance early in your career is going to be beneficial because it's going to be cheaper. And when you own that policy, it's going to travel with you no matter where you go throughout your career. Some individual policies versus having a policy that your employer offers, totally different, because
Yeah.
once you leave that job, that coverage stops. But if you have your own policy, that will travel with you wherever you go.
Yeah. And that's such a huge deal nowadays too. For you, especially your first job, you said what, a year,
Yeah.
and then you were on the move. And
Yeah.
so having that coverage locked in is a huge deal. And your point about being young and healthy, you're 100% right. That's a phrase we use all the time. You're never going to be younger and healthier than you are today. So it makes a ton of sense to get this locked in because it makes a huge difference. And this is something that's not a short-term commitment. This is a long-term, potentially career-long commitment to something like disability insurance. And it matters from a cost standpoint that you're healthy, right? And that you're getting it younger. And for those that are in training, there's huge discounts that are available to them that get tacked onto that policy and they never go away. But if you miss out on those, then that's going to cost you thousands of dollars over your career that was unnecessary. So it makes a ton of sense to do it earlier. And so I appreciate your example of doing that. You're seeing injuries come through from sports all the time. Did it give you any peace of mind to have that disability coverage on yourself personally, just knowing the commitment that you've had to medicine, the investment you've made, the time commitment? How did that give you peace of mind?
As a surgeon, every time I walk in the operating room, I have peace of mind knowing that my hands are protected, knowing that my whole body is protected,
Yeah.
my ability to take care of my family is protected because we do risky work. We work long hours. We have to think, and it's almost like an athlete. If an athlete comes back from an injury and they lose one step, they can lose their job.
Yeah.
And if you lose part of your function, you can lose your ability to take care of patients. And if you
Right.
lose your ability to take care of patients, then for many hospital systems, you're not worth what they paid for. So you can lose your job and lose your ability to take care of all the things that you have amassed over time. So we're delicate individuals as physicians, especially as surgeons. If you develop a tremor or you tear your rotator cuff and you can't lift your arm, in orthopedics, we do a lot of physical work.
Right.
So it's like with workman's comp. Sometimes your people get injured and they're not able to go back to their previous level of function. So you just have to know that as you've invested so much early on, from money to time, relationship capital, you've invested so many things and you've delayed gratification. That's
Yeah.
the term that we heard about all the time, delayed gratification. And now you've made it, you've invested all these things and you waited to get here. Now you have to protect your ability to do your job and your ability to take care of your family, take care of yourself. It gives
Yeah.
you peace of mind for sure.
Yeah, that's awesome. What you've built from a mental capacity to do medicine, the physical capacity to do medicine, that's what generates your income. And your income is your largest financial asset. It's going to be worth millions, probably tens of millions for some doctors, especially surgeons, over the course of your career. So protecting it with a percent or two of your income each year, it seems like a no-brainer to me. But one other thing you mentioned that I want to touch on, obviously you're seeing very real physical things that happen to people from a physician standpoint in today's kind of environment. This whole idea of burnout, mental health issues coming up with doctors, that's a piece of disability insurance too that a lot of doctors aren't thinking about. You have a psychiatrist who thinks, I don't really need disability insurance because I can sit here in a chair all day and do my job. The reality is that it protects mental health as well. So if you have a depressive episode or anxiety becomes something that incapacitates you from doing your work, there's coverage for that as well. And that's a huge deal for doctors, especially nowadays. And then, of course, there's illnesses that come up that prevent people from working too. You got cancer, and if you need treatment, unfortunately, that's what we've seen a lot of these young doctors over the last couple of years. We've seen more than a handful of doctors that have gone out for 6 to 8 months just because of a cancer diagnosis. And then the treatment that followed, it made them unable to perform as they needed to. And so they filed a claim on that. So yeah, I appreciate you touching on those. Those are really valuable points.
Are you a young physician who's frustrated in figuring out how you're going to continue to fund yourself through this early phase of your career? Are you tired of speaking to lenders who do not understand your plight? We have a solution for you. Let me introduce you to Doc2Doc Lending.
Hey everyone, I'm Dr. Zawadi Marshall, co-founder, CEO of Doc2Doc Lending. We are the exclusive lending partner for physicians and dentists in the United States. We underwrite our loans thoughtfully, knowing the physician journey and your career trajectory. We're a company that's been founded by doctors and built for doctors because we get it. Banks don't understand all the ways in which we struggle through educational debt, consumer debt, as we're trying to make ends meet during a very challenging time of our lives. Doc2Doc is underwritten with thoughtful process that's meant to give you credit for all the unique physician characteristics that you have, like being board certified, having a dual degree, undergoing and finishing a specialty or a fellowship as well, and just being employed as a physician. All of those things give you credit to get your interest rate lower with our platform.
So we are glad to partner with Doc2Doc Lending. So if you are stuck trying to figure out where you can get funding or where you can continue to support your family during this time of transition in your career, we offer you a solution. Doc2Doc Lending, physician owned, understands your plight, understands what it's like to be an early physician or a physician who wants to do something outside of medicine. Check out Doc2Doc Lending. This segment is a paid advertisement for Doc2Doc Lending Inc. Loans are made available by DR Bank, member FDIC, and are subject to credit approval and available in approved states only. Representative APRs for Doc2Doc range from 9.99% to 26.99%. Terms and conditions available at doc2doclending.com. I would like to say also too, because I'm a healthy individual, thank God. But for many people, if you're a resident or you're finishing medical school, starting residency, and you know that you have medical diagnosis, because you can be excluded from your ability to even have disability insurance, period. So especially if you have pre-existing diagnoses, doing this during residency could be your only time.
That's right.
So you need to be educated, especially if you have diabetes or ADHD or whatever your diagnosis is. You need to know how that affects your ability to be insured, as well as, unfortunately, pregnancy is a diagnosis. And once pregnancy is a diagnosis on your chart, it stays there forever. God forbid you have any complications. These are all things that you have to take into consideration before letting that window of being in training pass you by.
Yeah. Thank you for sharing that. That's really wise. Yeah. All those items are true. And again, you're right that some of the only options available to people who would be unable to be underwritten for disability insurance, meaning going through medical review by an insurance company, some of those options only exist while you're in that training program. So it's prudent to examine your options right away as soon as you can. So kind of harkening back a little bit, what were some of the financial habits that you feel like you've installed in your life that have really made a significant difference? And this could be post training, of course, into your current years.
One of the main things is automating my life.
Mm.
When you have a bill, putting it on auto pay, when you have a credit card, even if you're not going to pay it off, which I would suggest, but make a minimum payment so you're not missing these payments, especially with your student loans, automating those payments. Because if you start to miss payments, whatever your percentage is that you're paying can triple sometimes. So especially with credit cards, you do not want to let these things balloon out of control. You don't want to lose your house because you missed one payment. and the rate changed, and now you can't afford it. So I'd say automating my life was the main thing, and then actually starting to pay myself first. Many
Mm,
people will say, hey, pay yourself first. What does that mean? Okay, I have my budget and I know I have these bills to pay, and I'm going to live within my means so that I can pay myself by investing.
mm.
I can pay myself by making sure I'm putting away money for retirement. These are things that are very critical, because at some point you're going to have to stop working. And for
Yeah.
many people is at an age way earlier than you determine. For some people, you get to work until you feel like you want to stop. For many others, you have to stop for other reasons. So I would say automating payments and then paying myself, meaning investing in myself, making sure I'm saving for retirement, making sure I'm putting away money before I start to pay everyone else.
Yeah, I love that a whole lot. There's a book called The Automatic Millionaire out there, and it's talking exactly about what you are right now. This is especially potent for physicians. You're on a time crunch. And so a lot of these things that you're talking about are one time set it and forget it, right? Like you can have deposits go from your paycheck straight into an investment account or a savings account. You can have your debt automatically being paid down and you don't have to think about it to a large degree. So I really love that advice right there. That's really potent. Are there any small steps that when you're in residency, fellowship, even med school, what are some maybe small actions that they could be taking that kind of gets them started in the right direction financially?
Some of them are learn to live within the means of a paycheck as a resident. And if you will duplicate that for a couple of years, I'm not saying for the rest of your life, I'm not saying never take a vacation or never take your significant other out on a nice dinner. But if you will learn to be comfortable in that uncomfortable situation and learn to keep your life at that same stage for a few years and pay down your debt, pay down those student loans, and start to invest early, it will make a world of difference, because you cannot overcome time with investment. Compound
Mm,
interest is real. Also, interest on your loans are real as well. So
yeah.
the longer they sit, the higher they grow. The earlier you invest, the higher it's going to grow as well.
I think that's fantastic. Yeah. When it comes to investing, more time in the market is always best. It
Yeah,
almost always wins in every situation. The idea of living like a resident for just a couple of years after you get out of training and you become an attending, that's a hard pill to swallow
it's
for
a
a lot
hard
of
pill to
doctors.
swallow.
And
Yeah.
I've kind of put a similar idea like that out on social media and I get mixed reactions every single time. It's a pretty, it kind of pokes people in a different way because there is this mentality of, I've just been through the ringer and it's time to reward myself. It's time for me to be able to be on a different level from a lifestyle standpoint. So this lifestyle creep starts happening. And before you know it, you're behind, compounded a lot more years than you were before because doctors are starting off in life from a financial standpoint a lot further behind their peers. So, yeah, getting some of those things figured out early in the attending years is so critical from a time and market standpoint. So, how have you managed to balance your career in medicine with some of your financial goals?
So I'll say my career in medicine is my main source. At this point, it's my main source. So I think when you start off, you have medicine, which is going to pay you a good income. You have to be able to use that income, because it might not always be there, or you might decide, hey, I don't want to work as hard as I'm working in my early career. And as you start to transition out of medicine, you want to have other streams, so multiple streams of income, whether it's passive forms of investment, whether it's active forms of investment, maybe with real estate, or if it's using your talents and abilities to do other things. For instance, as you mentioned, I have a podcast, I do speaking. There are many different ways as a physician that you can use your talents, your name, image, and likeness as well, to generate income, which many times you don't know anything about this in the
Yeah.
beginning. I've learned so much just by trial and error over time. And when you perfect your craft and do it well, which is what I would tell people that are coming out of residency, first concentrate on being the best doctor you can. Master that. Once you're comfortable with your day-to-day flow of medicine, then start to introduce other things. Many people want to skip that step, but that's very critical.
That's good advice. I appreciate that. Have you ever faced any tension between maybe the outside financial opportunities relative to your medical career? You have doctors that are making their income, but they do want that second income flow. And so they start looking into real estate, but then you got time pressures or even knowledge pressures. You don't know all those things. So
Yeah.
have you ever experienced that sort of tension or even confusion in that?
Sure. Almost from a physician standpoint, we're used to taking courses, going to classes, studying for exams, and then take the test, which is different from entrepreneurship. Entrepreneurship, you see the test,
Yeah.
and then before you even start studying on it, sometimes you'll start taking the test, and
Yeah.
you'll learn how to take that test as you go along, which has to be a mindset shift for
Yeah.
many physicians, because we want to be perfect. In business and entrepreneurship, you learn to be perfect by failing and continuing to grow. So I think that dynamic is difficult for many physicians. Many physicians are not necessarily risk takers. I think we have a hard time with making money without working, so to speak. We're so used to being present, exchanging our time for money, that it almost seems foreign that I can invest this money and I wake up in the morning and the paycheck is there. It almost doesn't feel clean. It doesn't feel right to us many times, but it's many different ways to generate income in this world.
Yeah.
And you do not have to have a medical license to do it. But I think we're so highly trained and so highly specialized that many times we have a hard time seeing the world outside of what we do.
Yeah, that's really potent. Just how has gaining financial literacy and being in the understanding about money helped you become
Yeah.
a better doctor?
One thing that we lack in many medical schools or residencies is the financial literacy training. So I think that as you become more aware of who you are financially, or what money means to you, how you want money to impact your career or impact your life, I think that allows you to practice medicine different, as well as being more informed about, hey, if I do this many procedures or I see this many patients, this is what my value is. Because many people don't tell you what your value is in a healthcare system.
Mm.
Many times you're told that, hey, you're not making your quota, you're not doing this, you're not doing that. But I think as you become more aware financially of money and just the world in general, you understand your value and you understand what your practice means and how you want to utilize that as far as your whole person or your whole life. Because many times we put ourselves in a box as a physician and don't realize that we were a person for 30 plus years for many people before you ever became, maybe 25, 26 years before you became MD, and then another 5 years or so before you became that surgeon or the pathologist or the radiologist. So you have other interests. And many times, the better stewards you are with your money, you're able to introduce more of those interests.
Yeah, that's really great. I appreciate that. Everything that we're talking about is basic, maybe financial activities you need to do, objectives that need to be accomplished, whether that's disability insurance or setting up some automatic investing, some basic things that need to be done. But what's the point? This whole idea of financial freedom is a phrase that's out there. From a physician standpoint, what does that even mean to you, this idea of financial freedom?
For me, that means that I'm able to be in control of my life. I'm able to choose if I want to take a vacation with my family. I'm able to choose if I want to work for a 30-year career or if I want to stop working at 15 years. It gives you the ability to be in control. It gives you the ability to be in the moment and enjoy life more so than just having to continue to chase that next thing that's going. So I think that's what financial freedom means to me. For everyone else, it's different. Everybody has to define what it means for you. But I want to be able to spend time with my wife and my children while I'm young enough to move. I want to be able to vacation. Even if I decide to, hey, pivot out of medicine, I want to be able to do that because I want to set myself up to be able to not only be fine today, but have my generations after me be fine,
Yeah,
to
that's
generate wealth.
fantastic.
Yeah,
Yeah, and what I hear you say is that it gives you financial freedom, gives you options. It gives you the option to
absolutely.
choose where you want to live your life and how you want to live
Mhm.
your life. And if burnout's a real thing for you as a doctor, guess what? You have an option to not do that anymore. Or maybe that's not an issue for you, but you want to just take vacations or be able to work less. Those are all options now that are on the table because of that financial freedom that you have.
Yeah, you
Um,
mentioned burnout. I don't feel that physicians burn out because they're not tough or they're not resilient. I feel
yeah,
that physicians burn out many times because they feel that they have so many external burdens outside of just taking care of that patient that's sitting in front of them,
yeah,
whether it's dealing with insurance, whether it's dealing with trying to be reimbursed for the care that you give to your patients, or if it's just dealing with debt and maybe not being as financially secure as you want. That brings a lot of pressure when you're thinking about how you're going to take care of your loved ones. All these things can squeeze you to the point where you feel burned out, or you feel like, what's the reason for you continuing to show up if you cannot take care of yourself or your family?
Yeah. Love it. Last question here. If you can put yourself back in the shoes of a young doctor, maybe just getting out of med school, going into residency in that time frame, what kind of pep talk would you give yourself as it relates to finances? Like, what would you be telling your younger self?
So I would tell myself that, number one, I've always been tough on myself. I would say, just relax, it's going to be fine. At the same time, you want to start making decisions early. I would definitely go back and tell myself, hey, you know what? Make those minimum payments for your student loans.
Yeah.
And hey, you know what? Don't be afraid to invest your money. I was raised to get a good job, save your money, get a good 401k, work, and retire. I think that time has passed us. And I think that you have to be a lot more creative these days to be able to really secure your future. We can't rely on other people to do it for us.
Yeah, that's good. Dr. Burgess, thank you again so much for taking time with us. Your wisdom and advice is very valuable to young docs. So hopefully they'll take it. Appreciate it, and hope you have a great rest of your day.
Absolutely. Thank you.
Thank you.
Thank you for continuing to support this podcast. If you enjoyed this episode, then please leave a 5-star review. And if you haven't done so, subscribe so you continue to get the updated episodes. Until later, peace.
Hey, time out with the sports doc. Keep our head right in the game. We ain't never stopping. You are now tuned in. Trust you don't want to miss. This is where life, sports, and medicine